Awesome. Well, I will introduce our first year medical students, Michelle and Kier, who are going to introduce you all. Thank you so much for being here.
Well, do you hear me?
Yes.
Oh, the internet is not stable.
That's okay,
okay.
Sue,
I like to make sure that I like to make sure that the pediatric team is on so that everyone can see each other. Hold on just 1 second. Let me check the pediatric team ค่ะเกดจ๊ะอยู่ไหมได้ยินกันหรือเปล่าคะยังไม่ต้องเปิดกล้องก็ได้
We can share the PowerPoint, but we could not show the picture. I don't know why. Like you could not see my face. I don't know.
So we could hear you at first, Dr. Case, but we can't hear you anymore.
เขาไม่ได้ยินเสียงเราด้วยอ่ะ
And the pediatric faculty, we can't see you, but we can hear you just fine.
Okay.
We hear
Okay
you.
ค่ะ If you can hear me, it's okay ค่ะ Thank you.
Yeah. It's perfect.
Okay, so we're ready to start. All right, sounds good. So I'd like to introduce the adult infectious disease faculty, and Michelle will be introducing the pediatric faculty. So I'd like to first introduce Dr. PK, who is adult infectious disease faculty at Selective Hospital in Mahidol University in Thailand. She has interest in pharmacokinetics and pharmacodynamics of antimicrobial agents, antimicrobial stewardship, bacterial resistance, and medical education. And next, I would also like to introduce another adult infectious disease faculty, Dr. AJ. He is an adult infectious disease faculty at Selective Hospital and Mahidol University as well, with research interests in clinical and diagnostic microbiology.
And for our pediatric infectious disease faculty, we've got Dr. Casey. She specializes in pediatrics, infectious diseases at Siraj Hospital at Mahidol University. Her research interests include HIV, tuberculosis, tropical diseases such as dengue, and vaccines. We also have Dr. Kess. Dr. Kess is a pediatrics infectious disease faculty at Siraj Hospital partnered with Mahidol University, and will speak on the topic of persistence of anti-SARS-CoV-2 antibodies in infants born to the mothers who have received COVID-19 vaccination during pregnancy at Siraj Hospital during the years of 2021 to 2023.
And before we start, I would like to just share with the audience here today. Feel free to drop any question in the chat, or send it directly to everyone, or to the panelists, or to the moderators, so Michelle and I, so we can ask the question as well. And we'd like to open with a question to. Oh, I see that Dr. Kaz is sharing her screen. Yeah, go ahead. I think you're on mute. If you're talking, Dr. Casey, we cannot hear you.
No, I'm not talking.
My slide. Can you see my slide?
Yes.
Yes, we can see.
Okay. The topic is the persistence of anti-SARS-CoV-2 antibody in infants born to the mother who had received COVID-19 vaccination during pregnancy at Selective Hospital 2021 to 2023. And as you know that the maternal SARS-CoV-2 infection during pregnancy can cause severe like perinatal or postnatal complications. And we have known that the effectiveness of the vaccination like mRNA vaccine BNT162b2 in pregnant women was similar to non-pregnant women. And also the effectiveness of the maternal vaccination during pregnancy against COVID-19 hospitalization in infant age less than 6 months old was 61%. And however, we know that the COVID-19 vaccination during pregnancy can induce antibodies that pass through the cord, but transplacental SARS-CoV-2 antibody level and persistence of this antibody still not well established, or we have limited information about that. And when compare the mRNA vaccination to natural infection with COVID-19 in pregnant and lactating women, the vaccination groups result in higher level of antibodies. And timing of the vaccination and infection during pregnancy will affect cord antibody level. So we have the objective of this study. The primary objective was to determine the SARS-CoV-2 antibody levels of neonates whose mother received COVID-19 vaccination at 3 different time points: at birth, 2 to 4 months, and 6 months of age. The secondary objective was to compare the SARS-CoV-2 antibodies level of neonates whose mother received COVID-19 vaccination at various timing of pregnancy, and to describe the relationship between SARS-CoV-2 antibody levels and the duration of breastfeeding. This is the prospective study, and we have the inclusion criteria for the mother that we include the pregnant woman who meet the one of the following criteria. The first one is pregnant woman who receive antenatal care and at least 22 weeks gestational age with a history of COVID-19 vaccination, at least 1 dose of any kind of COVID-19 vaccine, with the last dose within 3 months before pregnancy, or at least 1 dose of any COVID-19 vaccine type during pregnancy. And we also include the participants who previously participate in the study of safety and immunological response after COVID-19 vaccination in Thai pregnant women as well. And the participants have to capable to attend all the study visit according to the study schedule and understand Thai language. For the neonate, we enroll the neonate who meet all of the following criteria: that the neonate born from a pregnant woman who met the prior criteria and not more than 4 months of age. And the neonate can attend and follow the study schedule. And the exclusion criteria, we exclude only the one with the history of any current illness that might interfere with the result of the study, for example, immune deficiency or severe illness, or receive blood component or immunosuppressants. And the target of enrollment, we calculate that 230 cases would make our calculate. And with the dropout, so we will enroll 250 cases target with the duration of 2.5 years. So the study activities, the visit one is screening the mother, and we collect the cord batch at labor room at birth, and follow the newborn at 2 to 4 months of age, 1 point, and at 6 months of age is the visit 3. So it's 3 visits with the blood drawn. We collect the SARS-CoV-2 anti-receptor binding domain, IgG. We check for the anti-nucleocapsid antibody and the neutralizing antibody against Wuhan and Omicron BA1 and XBB 1.5 variant at 3 different time points. And at the 1 year of age, we have the telephone follow-up, the newborn, the infant to ask for the history of the COVID-19 infection and general well-being and the duration of breastfeeding of the neonate. So this is the table that we will have the study procedure. And we collect all the data of the newborn, like demographic data, medical illness, delivery record and any birth complication and the breastfeeding status, and also the maternal history. For example, delivery complication, dose and the timing of COVID-19 vaccination, and history of COVID-19 infection in pregnancy. And we will analyze the data, like the GMT or geometric mean titer of the anti-RBD IgG and T-test and Mann-Whitney U-test for analyze the association of COVID-19 vaccination and infection during pregnancy and anti-RBD IgG. So actually we can enroll at this time 229 infants. It is a small letter, but we have preliminary report, not the report, like the result of the blood of the anti-RBD IgG of 166 newborn for analysis. So we try to group the participants to 4 groups. The first 2 groups is the maternal who did not have history of COVID-19 infection during pregnancy. And the second group is the mother with the history of COVID-19 infection during pregnancy, and to see whether they receive vaccination before pregnancy or during the pregnancy. And we characterize to 4 groups and with the history of COVID-19 infection and without COVID-19 infection, and the history of the vaccination status before and during pregnancy. And we see the demographic data, for example, maternal age, maternal underlying disease, number of COVID-19 vaccination, and gestational age at last vaccination before delivery. And also the timing of the last vaccination during the first trimester, second trimester, or third trimester, or 3 months before pregnancy, we classify as before pregnancy. And the history of COVID-19 infection, almost 100% of pregnant women who have the COVID-19 infection is only asymptomatic or mild severity. And the characteristic of newborn, we classify like age, gestational age, preterm or term, have history of COVID-19 infection or not. And the result of the anti-SARS-CoV-2 RBD IgG antibody. And the anti-nucleocapsid antibody. And this is just the neutralizing antibody that we have. The result only 111 cases at birth, and we did not complete the study yet, but this is just the preliminary report.
Well, thank you, Ajahn Kate. Is there any question for Dr. Kate? Actually, the study has finished enrollment and now in the phase of follow-up. And the result that Dr. Kate just presented is the preliminary result of about halfway of the study. But we are waiting to finish the follow-up of all the babies. And then we'll have more data, particularly on the serological data. And then we'll do final analysis and then compose with a manuscript. So I think this would be a small but beautiful study in single site that perhaps if any one of the students would be interested, can join.
I had a little bit more of a broader question. I think a lot of us don't quite know what like who is the patient population that you guys serve at your hospital. Could you speak a little bit more about like the patients you see, the patients you don't see, like who this study is missing and who this study is like really targeting, if that makes sense.
Kate, you wanna answer? Okay, perhaps I'll respond first. We are a tertiary care center where majority of the patients are the ones that have more serious illnesses. And for COVID-19, we are the center for when there are cases that is quite severe or you know, when they have problems. We are also running the study that majority of the questions for implementation of that national vaccine program would be conducting at. So majority of the people who we serve are well a little lower socioeconomic status relatively, but we also have some you know higher status socioeconomic status. We have some of them, particularly those who are very serious or need more higher degree of expertise in care. They will be referred to us. So majority would be average or relatively lower income people. In terms of those who we would miss would be someone who are relatively you know, in the well-to-do and not seriously ill. So if you are seriously ill, you want to come to be, you know, staying in our hospital, because it's not only you get the best specialist of the country, but you also get the best price. So that is why we get, you know, relatively more poorer people and more and sicker people.
Thank you, and thank you for sharing pediatric research here as well. I just want to let the student know and the audience know that these are a partner conversation, and then the partner usually presents something they're working on, and then we can ask questions and see if there's any way to help that we can, as a student, to help and get involved as well. And I do have a follow-up questions on the last presentation. Could you give us a sense of how is the Thailand culture like, and the people there in response to research? Are they such as the receptivity, whether their eagerness to participate in research, or do you have any difficulty in recruitment or even retention during your follow-up study as well that you're currently working on?
Yeah, most of the time, they don't understand much about research, but what we have in here in terms of culture is that they trust us. So our center is the largest and the very first public hospital in Thailand. So we gain a lot of trust. Here's the place where, you know, even the king come to stay. So in terms of reputation and trust, we are there. So once we introduce any kind of research project to a patient, whether they can be potential subjects, we invite them. To begin with, they will trust us, and they'll ask that, what if it were your child? Would you enroll? Or what if it if it's in what would I suggest? What would the doctor suggest? If the doctor suggests that, oh, I should go, then they go. So majority is like that. Now we have people who social media is very good. Now they have people who can gain the information from social media. So when we when we advertise the new project, we get a lot of attention, and they come to show their interest in recruitment, in joining the study. In terms of retention, that's a good question, and it's a pain for every single kind of study program. You need to have good retention, and we are quite good in for pediatric population. Again, they trust us, and when we provide research conduct study procedure, we also provide general care, anticipatory guidance, supervision, child health supervision, vaccinations, and so on. All these really gain trust and make them stay with us.
That's great to hear, with the trusting relationship you have.
Yeah, and perhaps one more thing. When they join the study program, they feel like they have a little privilege coming to the hospital. Actually, they like that. And they also get the travel fee, which is something that is very special for them. They only feel that they have to pay money when they come to the hospital, but this time they come and they get money. So it's something they they are quite happy with. And all the nurses in the pediatric service, the people, the staff, they love how to please the children. So it's quite easier to please. So once the children are happy, the parents will definitely happy. Yes.
So we actually have a question from the chat. So Kate said, congratulations on completing enrollment. Do you foresee results influencing clinical guidelines or policies in your hospital? How do research findings move to practice in your hospital?
Kate, you wanna respond?
Thank you, Kap. But actually, it's not finished enrollment yet. But we have a little bit struggle at this time point because of the COVID-19 is not, how to say, not like at the beginning that everyone concerned and the mother concerned. So they would like to prevent their infant, they would to receive the vaccination. But at this time, we can allow 229 cases, not meet the 250 cases. But at this number, we can have like 80% power to receive the calculation. But it's very difficult to maintain the subject to come at the 6 months of age. Actually, we know that it's not easy for the mother who allow the infant to let the blood drawn at the beginning because of they have to come like 2 to 4 months of age and 6 months of age to let them to receive blood drawn for the young baby, and the concern of COVID-19 is lower than the beginning that we start enrollment. But however, we hope that we can finish, and the result that I show at the beginning, they have more information about the transplacenta antibody to the infant is lower, and it will not more than 6 months. And also, I think that if we receive the NT or neutralizing antibody and complete the data, we might have some guidance, or from this study information may have the guide for the policy of the vaccination in mother or the young infant.
Actually, may I add in a little bit on top of Dr. Kate's study? What Dr. Kate's mentioned that we with the result of our study, we should be able to confirm how important it is to be vaccinating in time for young babies, and that there are a lot of resistance in vaccination among pregnant women in Thailand, and I believe is all over the world. And with this study, we gain knowledge that what is the practice of pregnancy, vaccination in pregnancy in Thai population. We found that although we suggest the vaccine during pregnancy, very few of them accept vaccination, particularly those who have had vaccination, COVID-19 vaccination prior to their pregnancy. So they said, "Oh, I'm safe. I don't want it anymore." And they believe in a lot of news that vaccination during pregnancy is not safe for their pregnancy or for their babies. So we have a hard time enrolling subjects, the mother subjects, in the recent months because the disease has been decreased, and the worrisome about severe illness and so on is not as strong as the very beginning of the pandemic, where although they worry about vaccination, but they want to be safe, so they tend to be more accepting vaccination during pregnancy. But nowadays, as the cases, the severe cases are lower, much lower. The death cases are much lower. So pregnant women, they tend to, want to be in a comfort zone where they don't want to take any risk of getting vaccination. That's what they believe, although we suggest. So the second thing is that, as we know that the second trimester is quite effective. After second trimester is more effective in terms of delivering the antibodies because the antibody will be peak soon after the vaccination. So after the second trimester is the best time because the antibody will be delivered to the babies at the in the higher level, relatively higher levels. So we expect that expect to see and confirm that if you vaccinate after second trimester, the antibody levels, can be shown in babies that lasting longer. That is what we like to see because there are discrepancy in recommendations of the timing of vaccination in pregnant women. In European society, they will suggest vaccination in pregnant women in relatively earlier gestational age, while in the United States, relatively later in the gestational age. This is based upon like the Tdap vaccine, influenza vaccine, and so on. So COVID-19, we have the evidence that after 20 weeks of gestation, the efficacy in terms of protecting babies are higher. However, there is no very few or limited data to show that antibody in the babies is like that, supporting the protective observation that we found. But we need to really show that, okay, that you don't see, that you see better protection after 20 weeks of gestation, vaccination in the mother, really is the reason for protection in babies. So you want to know that. So with the good evidence, that is by antibody levels. So if you can demonstrate that, and so that you can say for sure, and that confirm or assure the OBGYN doctors that, oh, please do vaccinating after second trimester or even after during third trimester. So these are the things we like to see. However, during the study, we found a lot of COVID-19 outbreak in the population. So we found several pregnant women who really had vaccination, but also come down with infection, natural infection. So we also like to see that with that, maternal antibody that passed to the babies would be higher and even last longer. So these are the scientific questions that we like to demonstrate. And without this, we can analyze and put into the recommendation in practice later on that, okay, we demonstrate that, the best thing is to vaccinate during third trimester or any time during pregnancy is fine. Or if you get infection, that's fine. You don't need to vaccinate anymore or, things like that.
This is a bit of a niche question, but in America, we're seeing some vaccine hesitancy. Is that a thing in Thailand, or is that just like in general?
เหมือนกันแหละ vaccine hesitancy
ค่ะเกตตอบกันไหม
Yes, we also have a problem with the vaccination hesitancy, particularly in pregnant women, because they would concern about their baby. So it depends on the OB and the pediatrician who try to encourage them and give them information about the benefit and the good of the vaccination that can protect not only the mother but also their infants as well. But we really have the problems of the vaccine hesitation. Not only the COVID-19 vaccine, also like influenza vaccine or any new vaccines that coming up.
Right. I think for routine baby vaccine, we got very little vaccine hesitancy. But for adult vaccine and particularly COVID-19, because a lot of fake news. So is a big problem in here as well. Particularly the high risk people, for some reason they just get a lot of wrong information. Yeah. And they like to share those wrong information.
Yes, that is a big challenge here as well in US. So I don't want to be mindful of the time to give some time to the adult faculty as well. If any audience have any questions for the pediatric faculty, feel free to drop in the chat. And then if we have time, we can also come back to this after the adult presentation as well. Now I have to give the time to Dr. PK and Dr. AJ.
Right, thank you so much. And for the pet ID is very interesting, and I can do something like that for the immunology, whatever. So may I share my slide, just short slide presentation? Share screen, this one. Share. Okay, is that come up? Okay, good.
Yes.
All right. So thank you for the opportunities. And I think in this Zoom chat, we have many of medical students, right? Who is interested in this. And I know from Tracy that this is called Discovery Year for UCLA medical student, right? So I would like to think about how you discovery for your new curriculum. We look back for our research that already done or is going on, but I think discovery is discovery. So I and my team come up with the new project for UCLA medical student to get involved to discovery since the first. And I think you may have the experiences like this. First, teamwork in different cultures. The second is microbiological experience. The third is clinical experience. And the last is epidemiology experience. Our new project that just come up, especially for UCLA medical students, is the drug that called fosfomycin. In Thailand is IV form. In USA, you have just oral fosfomycin form for cystitis, something like that. And in Thailand, we have many gram-negative resistant cause infection, and that is very difficult to treat. So we have to combine the available antibiotics together to against with the resistant bacteria that we call CRE or carbapenem resistant enterobacterias. But with more than one antibiotics, we don't have enough to fight with this organism. The fosfomycin is the most one that we combine with other antibiotics. And this drug has very low complication or side effect. And you can up the dose like maximally unlimited. And we already did the PK and PD pharmacokinetics and pharmacodynamic of fosfomycin in the patient. So now we would like to see that the in vitro combination of fosfomycin with other drugs, synergistic in vitro, and correlation with clinical outcome of the patient. So if we come up with this, we are going on to do the IRB for everything that's complete when the UCLA medical student come here, so we can start the research. However, for discovering thing, that means you cannot just come and do the research or the part of the research, but you have to be start with us. Like when you agree to be with us, you have to research or review the literature, what is going on with CRE in Thailand, that different from CRE in USA or in Europe. And you will participate, since the proposal to ask for IRB to let us do the research. And then you can have the experience in Thailand to do the microbiological synergistic in vitro, something like that. And I and my team will bring you to see the patient. That is what I plan for the medical student. However, because you are a medical student that did not go to the clinical yet, so there will be many questions. So for here, I and Dr. AJ very welcome for your question. And also, everyone know me that when you come to Thailand, you will not do just research and research. We work and we pray. So we need someone that passionate and energetic, because when you work very hard with your research, after that, you need more energetic to go out, to explore Thailand culture, to explore anything else. So work and pray together. And I don't think that someone will go to Thailand 6 to 9 months just in the laboratory or just in the with a computer and Excel, something like that. So we come up with this project just for you, you know what I mean. But this is going to be very useful for Thai patient as well. And the last thing that I will let you know, from my part, I think the question is for the time period that the medical student will be here and time to start, and the funding from UCLA, because honestly, we have in our hospital, we have rich of staff, rich of resources, but we poor of budget. So, and the expectations from your side from the medical student. So I will stop with this, and please feel free to ask me or Dr. AJ, or Dr. AJ have any things to talk with the medical student.
So I would like to add some points for the CRE. CRE is a carbapenem-resistant enterobacterias that is a major and ongoing threat in our hospitals. That's why we are really interested in these organisms. Even in United States have also a situation like us, about the CRE, but we have a different epidemiological data from the CRE that we have in the European country or Western country. Some kinds of mechanism of resistance might be different than us. That's why we have to find out any agents that can combat this organism. And we have also limited the new antimicrobial agents. That's why we have to use like NO agents to treat our patient. This is our project, try to get the best regimens to treat that we have, available antibiotic that we have to treat our patients. Okay, thank you, Dr. Ponpan.
Thank you. So from your end, any questions or any comments?
Thank you for sharing your research. It's really great timing with the current medical first year medical student actually learning about antibiotic, antimicrobial agents, and things like that as well. So it's really good timing for us. And I just have a question on, as we're learning these, I found that myself finding that a lot of these antibiotics are being changed constantly about treating which disease and that disease. And you mentioned about reading the literature to read the literature before doing this research as well on. So my question is, how do you navigate the literature being this figure out what is important for your research and for your population, because a lot of the antibiotic may be suitable for this population, but not necessarily for the population in Thailand and so forth as well.
All right, thank you for that very, very good question. So we already have all the information, and if we already agree for all of this research, I think we should have a small group overseas Zoom to give the content and knowledge, basically for medical students who would like to join this research, to let them know how different and what is the major antibiotics that we use in Thailand and why it is different from your country, like the gene that control the carbapenemase, that the antibiotic in your country couldn't cover the strain in Thailand, something like that. But we have to have a small meeting, like very frequently, not just come here and, oh, whatever, start from zero. No, we have to make a small group and give them the knowledge first and discussion. Is that correct answer for your question?
Yes, it did. Thank you. And I'd like to open the floor to the audience as well. If any audience have any question, feel free to speak up or to share in the chat.
Please feel free to ask. Even my English is like Thai language, but I think everyone can understand the language. Please feel free and open your video. This is like a very energetic Zoom meeting.
I'm really glad to hear that this has been a good Zoom meeting. If you wouldn't mind, would you actually go back to the experience slide so everyone can see what the project was about again?
Okay. I think I did something wrong, like pause screen share. Can you see that? We see that, right?
Yeah, you can just turn back to the second slide, please.
Is it?
No.
Oh no, I think I did something wrong about stop share. I will stop share and start share. Okay. Sorry about that. I'm not good in IT, but I'm good in training.
And talking.
I just wanted Dr. PK to ask just a really quick question that students may be wondering about, and that is to work on a project like this longitudinally, maybe to start doing the background research, perhaps even travel early to Thailand to meet everyone and kind of get some exposure and then go back during discovery year. Do you think that they will do okay on this project even if they don't speak Thai?
Yeah, sure. Very sure, because in the laboratory, I think they will work like 60%, 40%, 60% in the laboratory with our expertise, like Dr. Anupop and the other teacher that teach Dr. Anupop about the microbiology, that everyone will talk with your student in English. However, when you go to see the patient, because we will collect the organism from the patient and looking for the clinical, and that the student will go with me or Dr. Anupop to see the patient together, so we can translate for her. And every patient usually like cannot talk because they are very, very sick. However, I will do some temporary username and password for the medical student from UCLA, just to look for laboratory that in English. Is that okay?
I think most of our project is set up in the laboratory bench work. That's why I think it sounds like we going back to in the microbiology. That's why I think it's maybe fine for our for you medical students. For the clinical experiences, we can you can shadow our supervisor and our professor to see our patient.
Yeah, I just wanted to add that one thing that our students really appreciate when they come for clinical experiences is that exposure to microbiology in the clinical setting, because that's just not something they get a lot of exposure to here in the United States. So year after year, they say how valuable that is to spend time in the microbiology labs. Other than this bigger project, in this particular class right now, we have about 10 of our pathway students who are definitely going to be doing a discovery year with one of our partners abroad. And then we have a lot of other students who are not necessarily going to do that, but who can work on a smaller project. So maybe they'll have, a few weeks or a few months to work on a research project. It's something we call a concentration. Are there ways of getting involved with CCRES and some of the research that's happening, perhaps, helping with data cleaning or manuscript writing in English, things like that, where they could potentially play a role?
For me, it's like very, very useful and very appreciate that if someone can come to do to help me about manuscript English manuscript, because that is like very, very difficult for me. I can speak, but for the writing is my weak point. So if someone want to do something like that, I can give them to have like a short experience for that. And also other research project that is going on for now that I already sent to you, like brief 7 project. I can ask other colleagues to have something like that for a short time, like a few weeks. That should be fine.
Well,
I just wanted to tell the students to keep that in mind, and they can reach out to us and be connected if they're interested in getting involved either for like the more substantial discovery year project, or perhaps slightly smaller projects that they can do while they're in medical school. Sorry, Dr. Casey, were you going to speak?
Yeah. Just to add on for the small projects, we always have new projects pop up, every day. Like yesterday, I was approached for developing a manuscript for on a systematic review on the cardiac stent of using the heat. I'm not quite sure about it. I'm not cardiologist, but anyway, is about the stent that may save people who come down with acute myocardial infarction, heart attack, and that a request is from one of our related faculties that he would like us to help with the systematic review. And I think this will be great for medical students as well. Even more than one person, could be even 2 person. And we always get requests to draft a manuscript from people who from the faculties who finished their study project, but they don't have time to develop the manuscript. They have like they can develop like bullet points, PowerPoints, but to have someone help composing it into wordings with their contents and everything would be helpful, and that the student can learn as well. And like the study that Dr. Cates mentioned about, we also, the student can not just only to come and join some of the follow-up visits with the study subjects, the babies, but also can help with the or involved with the statistical analysis and manuscript development, which will be ready in perhaps the first quarter of next year, because we just finished the last enrollment, not too long ago. So we should finish the last follow-up by early next year, and then all the samples will be sent for laboratory analysis. And if they are also interested in working on the neutralizing antibody assays, we can have them piggyback, with the lab. And of course, during the free time, or even regularly, we have clinical activities like morning conference or grand rounds or bedside rounds. They can always join, because we are happy to change our language from Thai to English, but they can learn Thai as well. So all these things are good experience, depending on the time and availability of the students. So particularly in this small project where you don't even have to come, like the systematic review I was approached yesterday, I will, if I can get like interested students, 1 or 2 right now, say by within the next week or the next 2 weeks, then I will tell the faculty that, okay, I have students to perhaps helping you. We have the service on this manuscript development, manuscript editing in-house, and we have students from finishing master degree from the International College in Thailand. They are not as good as medical students, but at least those are folks that serving us the service. So we have to supervise very closely, and the faculty, of course, supervise very closely because that is their paper, but they need someone who are native English speaking to help either developing or polishing their paper. And they also can learn how to develop, write a manuscript, do submitting, learn how to do response to reviewer, learn how to, resubmitting, and, pain when they get rejection, and happiness when they get acceptance. So all these things, they have to learn along the way. It's life.
Thursday, I sent my short PowerPoint slide presentation to your WhatsApp.
Nope.
So for everyone, and any medical student would like to talk to me directly, I have WhatsApp that usually work in USA, but when you come to Thailand, you need Line app. But now I have WhatsApp.
Right.
No, this is great. And these are, on this call today, it's mainly focused on first-year medical students, but we also have Our second year medical students are pretty busy. Our third year are doing discovery year, but some of them could be interested in a side project, even if they're already working on, a dual degree or something else during discovery year. And then sometimes our fourth year students also have research electives and they're looking for projects like this. So I think, I'll just try to spread the word as widely as I can to all of our student listserv. And, hopefully we can get some of the people that joined this call today involved early and in a more longitudinal way. But I will share it with other years as well.
Thank
Super
you.
exciting. And I'm just like, I'm like super excited about trying to get this off the ground and find ways for us to collaborate more. I work more with trainees more closely than faculty. So that's where I feel like I have a little bit more voice. But over time, I think we'll also get some faculty involved in the work that you're doing as well. Really great work.
Yeah, very exciting too. Everyone from UCL is almost always responsible, energetic, and very friendly.
Yeah. We try, but you all too, I have to say.
Thank you. Thank you.
And very, very smart too.
Thank
At the
you.
end of this presentation, I just realized how little I know. I love it. All right. Well, we can go ahead and wrap up. It's a little bit late in the evening for the students, and they have their first exams coming up actually next week. So we will let them go back to studying, preparing for that. And I will be spreading the word, and any students that have an interest in working with you that are on this call, they can reach out to me and I will connect them with you right away.
Okay.
Yeah.
Thank you so
By-
much.
Thank
By
you.
the way, by the way, Tracy,
Uh-huh.
as I mentioned that there are manuscript work pop up